Hello everyone, I'm Dr. Sunaina Pamnani, a pediatric and preventive dentist practicing at Smile Isle Dental Care, North Bangalore, Karnataka. I'm going to give you a brief about certain tips and tricks about how to maintain the oral health care for your children, which can be a tedious task. Just very basic things about how to brush, what kind of brush you can use, how much toothpaste you can use, and how to get your toddlers engaged in the brushing activity, which seems like a very big task for a lot of parents these days. You should start brushing your child's teeth as soon as the first milk tooth erupts, which is roughly around the age of 6 to 7 months. Even before the tooth erupts, you can start cleaning your baby's gums basically after every feed with a piece of gauze or a soft napkin dipped in water. You can squeeze out the excess water and just dab around the gums of the baby to get rid of the excess milk which is there, which in turn is going to prevent the dental cavities from forming. How can you brush them without a battle? This is a question that we get asked more often than you can imagine. So when it comes to toddlers, they are not the most cooperative of patients or most cooperative of human beings because they don't want to do something which they don't like to do. So you can make brushing a very fun ritual. While laying down your child's toothbrush, you can lay down your own. Children love to mimic. So if they see that you are doing something, they are going to love to do what you are doing and they will follow that. So you can also start brushing your teeth, or you can make brushing a family activity. So when they see that this is a daily ritual or it's like a part of getting ready to go to bed, they are going to be more engaged and more involved in doing so. You can also let your toddler have a set of toothbrushes, maybe different cartoon characters or with different colors, and you can ask them to pick the toothbrush for that particular day if they would like to do so. While doing so, you can ask them and you can make them involved in the decision making because kids love to be independent. So instead of asking them, are you ready to brush your teeth? You can ask, which brush would you like to use today? Using a separate toothbrush for your child's stuffed animals or stuffed toys or soft toys, and show them that even the teddy or the dolly, whatever names they would like to call their soft toys, are also brushing their teeth. So this way they can also be more motivated to brush their own. And also compliment them at the end of the brushing activity, like say how sparkly your smile is looking, that's so good, you've done a great job at getting rid of the bacteria, your smile is looking beautiful. So something more rewarding. You can also incorporate certain rewards, like you can give them stickers, or you can allow them to hold their stuffed toy while sleeping, the favorite soft toy if they have any, or you can also read them their favorite storybook at the end of the brushing activity, which will act like a positive reinforcement for them. Electric toothbrushes are generally recommended for children who are 3 years or above, but whatever said and done, every child's maturity and ability to handle the toothbrush varies. So if you feel your child is okay to go ahead with the electric toothbrushes, you can definitely go ahead with the electric toothbrushes because they are highly recommended and they are more effective in terms of removing the plaque or the tartar buildup on the tooth. When it comes to selecting the right toothpaste, you can take recommendation from your child's pediatric dentist. Depending upon the age, there are certain age-related toothpaste that we recommend. Say for example, for children who are younger than 3 years of age, we recommend using a zero fluoride toothpaste. For children who are 3 years and above, we can use a mildly fluoridated toothpaste, and for children who are 6 and above, we can use the one which the adults use. For the children who are 3 years or younger, you can just use about like a smear size of a toothpaste, just the amount of a rice grain. And for children who are 3 years and older, you can use the size of a pea, like a green pea. That much amount of toothpaste is sufficient for those children. Children should basically get their dental checkup done once in every 6 months. This biannual checkup allows the dentist to overall monitor the health of your child, how the teeth are erupting, how the teeth are aligning, how the teeth are shedding, how the child is maintaining the oral hygiene. This also helps in alleviating the dental fear in children when they visit the dentist and the dental clinic regularly. Yes, even if your child is brushing and flossing regularly, you do need to see a dentist and get the professional cleaning done. While brushing and flossing help in removing the plaque buildup or the food debris from your teeth, a professional cleaning goes beyond that and it helps remove the tartar which is built up on your tooth. So getting this biannual cleaning done or once in 6 months cleaning done also allows the dentist to, examine the child's overall health and monitor or catch any potential problems even before they become very serious. According to the American Academy of Pediatric Dentistry, your child should visit the pediatric dentist as early as 6 months of age, that is when the first milk tooth erupts, or their first birthday, whichever is sooner. However, getting a professional cleaning can also wait up until your child has a few more teeth. So roughly by the age of 3 years is a good time to start the professional dental cleaning. Yes, the baby teeth do need cleaning by a pediatric dentist even though that they are going to fall at a later date. While the teeth may be temporary, but they play a crucial role in the development of the jaw and the growth of the jaw. They also play a crucial role in speech development. They also help in biting and chewing up until your permanent teeth have erupted. They play a major role in how child's permanent teeth are going to align. Neglecting the baby teeth can lead to pain, serious infections. It can also lead to alignment issues in the permanent teeth. Your enamel is highly durable. Basically, it is mostly comprised of minerals. Also, the enamel is the strongest structure in the human body. It is even stronger than your bones. Imagine chewing and biting on your teeth for 1,000 times during a day. If that does not cause any damage to your enamel, the cleaning is not going to cause any damage to the enamel. Because when we are doing cleaning, we are just removing the superficial plaque or tartar buildup by using ultrasonic devices. So which does not cause any damage to your enamel whatsoever.